This is the introduction to the female reproductive system, chapter 51. Let's talk about the anatomy and physiology of the female reproductive system. Well, the external genitalia is displayed for you pretty well on page 997, figure 51.1. It points out the major structures of the external genitalia. The internal genitalia, the purpose of that is to secrete mucus that cleanses the vagina and maintains the acid pH. It can also provide a route for infectious organisms. In fact, the vagina is an opening to your abdomen, because if you go from the uterus, fallopian tube, abdomen, essentially you could get a massive infection into the peritoneum. So breasts are accessories to reproduction. The menstrual cycle, well, it's important to know that the length averages about, and I say about, I know everyone's different, but for this purpose, it averages about 28 to 30 days. It can be affected by many things that occur in life, our stress, our anxiety. If we have intense physical activity, some gymnasts don't even have a menses, or illness. And it's important to know that if you keep a diary of any problems that you're having during your menstrual cycle, either pre-menses or post-menses, and a list of symptoms, what's happening to your body and how you're feeling, it will help the doctor diagnose you what hormone you need or what medication you need. Before I go on to the menstrual cycle, because I have another slide, I want to talk about the gravity and parity. Now that's important to know too, because gravity refers to the number of pregnancies that you've had. Now maybe you've lost or you've had an abortion, but you've been pregnant. That's gravity, pregnancies. Parity is actually the babies born, or the number of pregnancies that reach 20 weeks gestation, which is the point at which they're viable. So you might see gravity 2, para 1 on a chart, and that refers to 2 pregnancies, 1 baby. Now this is a picture actually of your menstrual cycle. So this is the female hormone cycle. So the release of the ovum, as you can see on the left there, is in response to the follicle stimulating hormone coming from the pituitary. Also the luteinizing hormone, you can see estrogen production beginning about week 8, or not week, day 8. And as you can see, the follicle develops. So it starts small, gets a little bit bigger as the FSH comes along, the luteinizing hormone, the estrogen, all these things are going on in your body. And then notice the third is the ovum with some fluid in there. And then on ovulation, or week 14, as shown in this picture, the ovulation occurs and the egg is released. And that's where the fallopian tube will pick it up and take it down. The fallopian tube to hopefully be implanted. But notice that there's a little bit of fluid that is released also during that time, which was in the follicle. That is released into the abdomen. It's only just 1 or 2 mLs, not much, but it can cause something called Mittelschmerz. Now, I know this isn't in your book. Let me spell it for you. Mittlschmerz. And that is the pain that you might feel. And this is why it's important that I want you to know about it, because sometimes you feel discomfort in your lower abdomen right when you're ovulating. It might be that fluid that was released from the follicle, and sometimes that fluid can form cysts as well. So the cyst, if you have ovarian cysts, it can be fluid buildup, or a cyst that's formed from the fluid. It didn't get dissolved by the body. It's usually not harmful. Then around week 14, the ovulation occurs, the egg is released, and the luteinizing hormone begins to decrease. And notice that the progesterone begins to increase, and that's progest. So that is the hormone that prepares the uterine lining for gestation. So it's progesterone. And then the corpus luteum begins to dissolve around day 28. And that egg, I'll show you on the next slide. Well, not this slide. Okay, the next one. So the internal female genitalia, here I just wanted to see a cross section. So you can see how the uterus lies on the bladder and how the colon is, and you can see the ovary and the fallopian tube. It's a good cross-section picture. It is in your book. Now here's your uterus, fallopian tubes, and ovaries, another good picture. You can see the ovary, and you can see the eggs in the ovary on the left there. Many eggs. You are born with all your eggs. So it's released one a month, and it's released into the abdomen, and those little tentacles on the fallopian tube grabs the egg and pulls it into the fallopian tube. And then it travels down the fallopian tube, hopefully doesn't implant in the fallopian tube because that's an ectopic pregnancy. Then it travels into the lining of the uterus, which has been preparing by the progesterone for implantation. Now, implantation does not occur, menses will happen, and you'll have your menstrual cycle. So this is the health history, your assessment. You want to, why are they here? What is the reason for seeking care? And then you want to talk about their health history, their present illness, and the age that they got their menses or the menarche. How many pregnancies have they had? What's their gravity and parity? And how about the family history? Did they have any history in the family of stillbirths or big babies? Did they have diabetes run in the family? A review of systems and their functional assessment. That's their diet history, any supplements they're taking, exercise, immunizations, exercise pattern. And then you want to start your physical exam, and you'll look at their face, head to toe, take their vital signs, their color, their skin, inspect the abdomen, any distension, because we are going to be talking about problems that occur. So when we're doing our initial assessment, you want to notice anything abnormal. Is their abdomen distended? Is it soft? Are there any lesions or swelling? You may examine their breasts. Do they complain of any discharge? Okay. So some diagnostic tests that can be performed would be a pelvic exam. Now, a pelvic exam, you want to, when you get your patients into position for these examinations, be sure you don't get them into position too far ahead of time so that they're uncomfortable. So you want to get them into a good position just before the doctor comes, that dorsal lithotomy position. You want some stains and cultures can be done. Colposcopy is where they inspect the cervix. Coldoscopy is important to know. In coldoscopy, oscopy is, of course, visualization. And this is of the uterus, ovaries, fallopian tubes through a small incision in the posterior vagina. And if your patient does have a coldoscopy, nothing should be inserted in the vagina. So they should not have any suppositories, any kind of intercourse or anything in the vagina after coldoscopy. Now, laparoscopy is done to visualize organs through an abdominal incision. It may require a second or third even small incision If any of you have had a laparoscopy, they usually go through the belly button, which is one of your incisions, and then they might make two little other ones, one on each side. And the reason they do that is so they can manipulate inside, so they can look around and insert a scope. And also, they inject gas. So they blow up the abdomen so that the organs are more easily visualized. Now, post-op, though, because they've injected this gas into the abdomen, the patient may experience shoulder pain. And that is like a gas bubble floating up to the shoulder. Sometimes C-sections even, patients post-op might get that. It's very intense shoulder pain, but it does resolve because it's gas, so it gets absorbed by the body. Now, dilatation and curettage is called a D&C. And that might be done, it's just a scraping of the uterus. It kind of is a reset, but it also can be diagnostic, but it helps clean out the uterus. Mammography detects breast cysts or tumors. And breast self-exam, or BSE, as it's called in your book, should be done. Now, this is important to know. We should all know this. It's done the same time each month at the end of the menstrual cycle. So that's the best time to do the breast self-exam. And the book does a really good explanation of a breast exam. Now, a breast biopsy is a definitive test for diagnosing breast cancer. This is just a picture of a laparoscopy. I thought it would be interesting for you to see how the laparoscope goes in through the belly button there, and they can look around, and there might be a couple other incisions, and that's the cannula there that might go in and help manipulate and move around some of the organs as well. This is a good picture. So some common therapeutic measures. So douching. Douching is not recommended for regular hygiene because it washes away elements that maintain the normal pH of the vagina. But the physician, now he can order to wash the vagina with bactericidal solution prior to a surgery if they're doing a vaginal hysterectomy or any other kind of diagnostic test. Cauterization is just a method to deliberate tissue destruction by means of heat. And this application of heat, that's like if you're uncomfortable, you can apply heat, dry, moist heat to relieve pain, or even dry heat. But notice in the patient teaching, it talks about the genital hygiene. Do not douche unless ordered to do so by the physician or nurse practitioner. Important to remember. This is again just an example of what I just said, the patient teaching. It's important to know about the genital hygiene and the douching. Don't do that. And to keep the genital area clean and dry, wear cotton panties. Now, some drug therapies I want to talk about, and those are on page 1007. So I know drugs are a lot, so I try to kind of point you to the ones that are really important for us to know, that really mean a lot. So let's look at the ovarian hormones. So those are to replace natural hormones or hormone replacement therapy. And Premarin might be a medication that you've probably heard of, but that's an important one, and it is listed on page 1007. Now there is a side effect of this, and that is breast tenderness. So it's important to remember that Premarin can cause breast tenderness. And it's not a bad sign, it's just a side effect. Then there's something called selective estrogen receptor modulators, or SERMs. We'll probably be talking about those a little later. Androgens are important. they inhibit the production of pituitary gonadotropin. They might give you masculine traits. Now, those are on page 1009, the androgens, danacrine, and notice that the use and action, it inhibits the production of pituitary gonadotropin. So, because it does that, and androgen is, it's going to give you a more masculine trait. It may give you hair, a deeper voice, and those are some side effects of androgens or danacrine. Then there's gonadotropin or releasing hormone agonists. There's oral contraceptives, vaginal contraceptives, subdermal contraceptives, intrauterine contraceptive devices, IUDs, levonorgestrel intrauterine contraceptive device, and then there's ovulatory stimulant and fertility drugs. Now those are important, and those are listed on page 1010. The purpose of Clomid is it stimulates actions of natural pituitary gonadotropins. So Clomid is used for infertility because it stimulates or mimics the action of natural gonadotropins. So that's important to know. Emergency contraceptive drugs, there is the morning after pill, and it has to be used within 72 hours of possible pregnancy. This is just a reminder. I took this from your book. So Premarin may experience breast tenderness, and that is listed under the ovarian hormone drug. Then there's the danacrine. This is repeating, so it must be important. Danacrine, which may develop, you may develop male characteristics, hair, lower voice. Clomid is used for infertility. It stimulates or mimics gonadotropins. Now there are some surgical procedures that are done. Abdominal procedures are performed through an abdominal incision. Now the incision usually is like a smiley face from ilium to ilium. That's the way they go in, like it's a bikini cut. If they think it's going to be a bigger type surgery, they might do a vertical incision. They can also do surgical procedures vaginally. They can remove the uterus vaginally now, and endoscopically. The nursing care varies with each approach, but you'll always assess for any excessive bleeding or vaginal discharge. All right, that was a pretty short chapter, huh? So I'll pick you up on chapter 51 on the next one. Thank you. Oh, question. Which of the following is not secreted by the ovaries? So the answer is C. Ovarian function includes maturation and release of ova and secretion of hormones, estrogen, progesterone, androgens, and relaxin. Thank you.